So at the start of palpation, we're going to take a minute or two to assess the skin. And in lab, we should be doing this in different areas. We're going to be assessing the skin on the back, the ankle, and the forearm, because the skin is very different in these areas. Think about the ankle, or especially the forearm. These areas are often exposed to the sun much more than the back or other areas. And so the skin over time is going to be very, very different. And what we're going to be looking for is the quality of the skin. And to do this, we're going to use the palm of the hand. And what you're going to do is you're going to place the palm of the hand on the skin area and just move over. You can push down deeper or do it lightly. Look to see what the quality of the movement is. Are there any restrictions? Do you have scar tissue that is there? You're also looking at the moisture level of the skin. Is it dry? Is it soft? Is it hard because of sclerosis? And you want to see exactly how it's moving. Is it thin? Again, you want to be very careful when palpating over thinner skin so that you don't end up causing friction and skin tears. We want to check temperature. Remember, we're looking for signs of inflammation, signs of infection. We want to see if the area that we're palpating is warm or even hot to the touch. And this is better performed with the back of the hand. And we're also going to look at consistency. In terms of that, is it the same throughout? Like I said, are there areas of binding, or are there scar tissue areas where the skin doesn't move very much at all? And we're going to be doing that through displacement, lifting, and rolling, and I'll show you a video of that in very shortly. And that consistency, the displacement, the lifting, the rolling, it should be the same with all three tests. Sometimes if you have increased moisture in an area, that could be a sign of the chronic regional pain syndrome. Again, if you have dry skin, remember the Turgor test, where you're picking up the skin on the back of the hand to see what the levels of hydration are. Because dehydration can definitely affect people and affect their mental capability. We're also looking for tenderness and hypersensitivity as we're going throughout palpation. Remember, our goal is to find what hurts, to see if there's anything abnormal underneath our fingers, but also to find the areas of tenderness or hypersensitivity. And we're going to start off in lab with a layer palpation, where you start off very lightly on the top with the skin, going down through the different layers, the epidermis and the dermis, then through the fat, the fascia, the muscle, and then all the way down to the bone. So this is a video from the Canadian osteopathic class, and this is going to show some skin rolling and lifting. And you can see the person lifting the skin here, moving it around, and then they're going to be slightly rolling up as they move along up the back. For skin rolling, essentially what you're doing is you are moving your fingers and dragging the thumbs behind it. And what you're looking for is just the same consistency. You can kind of see in this picture how the farther up the back they get, there's not as much lift with the skin, and so therefore there's some tighter fascia in there as well. So this lifting, this is ways that we can help assess what's going on during palpation.